Hi, Dr. Riaz Agha, consultant plastic surgeon on Harley Clinic Group. When I started my practice on Harley Street, I wanted to really develop what I felt would be a Rolls-Royce premier level practice that could really provide the cutting edge to patients. How am I different from other plastic surgeons who are in London or elsewhere in the country? I think that everyone has their own unique characteristics that distinguish them. They've got their own track record, got their own way of dealing with things and their own particular training and techniques that they favour or adopt. I try and take a broad approach. I try and listen to my patients and start with that. Good communication, I think, is a cornerstone of the practice. We have really good written and oral communication with all of our patients. We keep them up to date on what's going on in their journey and we listen to them. So when we have a consultation, we really listen to what they're looking to achieve, what is the particular look that they're looking for, really ask them about their own sort of social life, how this procedure fits into everything else that they're doing, ask them about their past history, past medical history, any previous surgery that they've had, medications, allergies, etc. Once we've got a good understanding of them, we have an examination and I do a really thorough examination, take measurements, analyse, take photos and really sort of go into it with them and understand how we can help them and give them options. I think it's important to give options. I always tell patients that this is aesthetic surgery, cosmetic surgery is not an emergency. They don't have to have anything done, but we can discuss a range of different options which they can consider the merits and risks of to help them make a decision about what they want to do. So the communication is really open. I really consider it as a partnership with the patients. We really do discuss, and it's not something that can take 10 minutes. We really do give people time when they come through for a consultation with us. It's really about being thorough, understanding the small details, and being able to then, once you have selected a particular operation and a treatment plan and a date, then really being able to technically deliver for patients. Now, I don't let patients leave the operating theatre until I'm satisfied that everything is perfect. I really do try and aim for that to the utmost of my ability. I try and make sure that everything is really absolutely the best that I can make it. Every stitch, every suture, every little manoeuvre is really as excellent as it could be. And where I'm not satisfied, I will correct it and I will make it even better. So being thorough and having attention to detail is really important. I've also evolved my practice over time. I used to use drains with tummy tucks and I have a drainless tummy tuck practice. It's allowed my patients to mobilise much more earlier. It's provided them with much less hassle, allowed them to be much more mobile, have a quicker recovery that's less painful. And I think that's really important. I also do a lot of innovative things that other surgeons may not do as much. For example, fat transfers, particularly on thinner ladies who want breast augmentations. I never thought that would be possible to the extent that I've taken it, and the before and afters that I've been able to achieve and the happiness in people's lives that I've been able to create has been really heartwarming and fulfilling for me as a surgeon. So introducing novel techniques, being on the cutting edge, as long as it's safe and the patients are with it, has really been an absolute cornerstone of the practice, and I'm very happy to be able to achieve that for patients. Overall, good communication, good consultation, good physical exam, really good technical delivery of the surgery, excellent aftercare, make myself available to all my patients 24/7 after the surgery for the rest of their lives. I think that's really important to be available, and bizarrely I don't really get phone calls at odd times, but I do always make it available. We've been really able to enhance the repertoire and really develop the kinds of procedures that we can offer at the clinic, and I think that's been really helpful. Not just surgical but also non-surgical. Provide Botox, fillers, microneedling and a range of other non-surgical therapies which are really helpful for patients. Many patients aren't ready for surgery or don't want to have surgery, or actually the non-surgical therapy could actually deliver their goal with far more predictability and less stress for them than a surgical technique could, and less downtime. So non-surgical therapies have been really important for us, and I think the mix of surgical and non-surgical has been a really important part of the practice as we go forward, as well as the innovation and the focus on communication and a personable approach to patients, which I think all of our patients remark on in their feedback as being a cornerstone of the practice.